these new recommendations reflect something that the old ones couldn't, which is all this new research looking at specific health endpoints. Like when they chose the ranges, they looked at what's best for our mood, our cognitive ability, medical conditions like diabetes, hypertension, and obesity.
With Miranda Kahn, J.D. Hayworth back with you on America's Forum. That was Dr. Holly Phillips, a CBS News medical contributor, talking about the National Sleep Foundation's most recent sleep recommendations. Now, there's an even newer sleep study out, I understand, that really makes you reconsider staying up much past 8 p.m.
Yeah, it does. The study done by a medical college in Qatar suggests that even missing just a half hour of sleep could put you at risk for obesity and type 2 diabetes. Just a half hour.
Maybe that was the problem a long time for me. Researchers found that people who lose sleep are 72% more likely to be obese, as opposed to those who slept very well. I would say
like
sleep.
Baby.
Well, no, remember the joke about sleeping like baby is that you wake up every 2 hours crying.
That's true.
So maybe we shouldn't say it. Bottom line is this: how can we avoid health risks? For more on these health matters, let's bring in Dr. Mitchell Gaynor, attending physician at New York Presbyterian Hospital, founder and president of Gaynor Integrative Oncology. Doc, thanks for your time. Give me your take on this study about losing sleep and gaining weight.
Well, it's really no surprise because sleep is intimately linked with a lot of neurotransmitters, and these are the same chemicals that are found throughout your gut. So if you even lose 30 minutes of sleep a night, your risk of diabetes and obesity goes up because your cortisol levels go up. That's a stress hormone, and that in turn controls inflammation, which makes you insensitive to insulin. So that actually helps create obesity and diabetes. So everything is very tightly linked.
So how much sleep exactly should we have? Because we've heard various different reports say 7, some say 8, some say even 9.
The best, what I tell my patients on the most recent data is 7 to 8 hours per night is optimal. Many people don't get that, and many people will say, well, I feel fine on 5 or 6. But when you actually look at their health and you start measuring certain blood tests like CRP or C-reactive protein, you find there's a lot of underlying inflammation in people that are going on less sleep than normal. So it's critically important for a variety of body functions, and that has to do at the level of your genes. Literally, genes are turned on that promote inflammation when you have sleep deprivation.
When I hear this and think about it, and think about all the sleep I've lost and all the weight I've gained over the years, Doc, I have to ask you, demographically, are there some age groups that are more vulnerable to this than others?
Well, a lot of studies are showing that it does become more difficult to sleep for a lot of people once they're over 60. And the reasons for this are unclear, but I have a lot of patients that'll tell me over 60, well, I just don't need as much sleep as I did when I was young. But the fact of the matter is there's no physiologic difference between being over 60 and requiring less sleep. You still need a good 7 to 8 hours. And it's very important to incorporate the right diet. You don't want to put foods in your body that are going to be turning on inflammation, like a lot of white sugar, white flour, heat-damaged oils. Those are the kinds of things that I really review with my patients and talk about in my book.
Dr. Mitchell Gaynor, we are so pleased to have you. Give us an update on sleep. We were wide awake to listen to every word, and I like the notion of 8 hours. 8 rhymes with great.
I like that.
And we look forward to that. Dr. Gaynor, hope to have you back. We'll talk more about your book in the not too distant future. When you talk to your kids and they say, I don't care, well, how do you combat that apathy? We'll talk with a young person who is fighting that notion that younger folks don't care. We care about it. We'll talk about it next. Stay tuned.